I'm Megan Murphy for the Huffington Post. After a car accident with 2 other cars and a horse on an English road, Stephen Thorpe was brought to the hospital with fractures to his face and his head. Doctors said he'd suffered catastrophic damage to his brain. Here's the BBC.
2 days later, as Stephen lay in a coma, his family were informed by doctors that there was no hope and they intended to switch off his life support machine.
Imagine being faced with the decision to end a loved one's life. Stephen's coma required his family to face a major decision. With 4 doctors telling Stephen's parents that he would never recover, they had to decide if they would wait in hope or end his suffering. What if something like this happened to someone in your family? What would you do? Who would you want to make this decision? Who deserves to make this decision? Welcome, English 137H. This is Raylene Borthwell with the story of the day. In this segment, we will discuss the controversial topic of who should have the final say when one is connected to life support. Should the decision be made by the person's family or the medical professional? Here is more on the story. In the United States, each state has different laws about withholding and withdrawing of life support. It is legally justified primarily by the principles of informed consent and informed refusal. The cases that set the precedent for this were the Quinlan case in New Jersey and the Barber case in California. In the Quinlan case, parents acting as surrogates for the patient in a vegetative state can practice that right for them. In the Barber case, the courts ruled that doctors charged with murder were not guilty for removing life-sustaining measures from a comatose patient with consent of the family. In both cases, the patients did not have an advance directive, otherwise known as a living will, which created a gray area where doctors and family are left to make the decision. Doctors understand the science of medicine. They would know that the patient is not suffering because brain signals cause pain, hunger, and thirst. The body reacts to lack of resources, but the patient cannot feel it. According to the New England Journal of Medicine, the patient will not suffer if taken off life support. However, if left on life support, the patient won't maintain the quality of life that most people desire. Doctors also have to consider other patients and the shortage of hospital beds. Patients in a persistent vegetative state could be potential organ donors. Doctors know that the older the patient is, the less likely he or she is to survive. A study by the New England Journal of Medicine found 15% of non-traumatic patients regain consciousness, and 52% of traumatic cases recover. In many cases, even the recovering patients have severe disabilities. The journal's figures show life expectancy decreases to between 2 to 5 years even after recovery.
Hi, I'm Quinn here from research. Fox News gives us some tangible data from the medical field. According to the Brain Injury Association, 35,000 to 40,000 patients are diagnosed with persistent vegetative state each year. However, there is no current data on deaths of life support patients. Fox News concludes that, like most medical professionals, Amanda Engler from the Texas Hospital Association feels that life support deaths are a fairly normal thing that, quote, you just don't think about. Back to you, really.
On top of all of this, doctors have a lot of weight on their shoulders as a responsible professional. They can never be 100% sure of a diagnosis. Administrative team coordinator in the ER of a local hospital gives her opinion on the issue.
I think the patient's spouse or parents should weigh in on the decision if the patient does not have an advance directive.
As a mother, she understands the point of view of families. As far as the families, what level of uncertainty is acceptable? A patient's family knows him or her personally and are often more in touch with the patient's wishes. The patients and their family's religious and spiritual beliefs are bound to play a role in how they feel about persistent vegetative state.
Hi, I'm Kylie Hansen, and I'm here from research reporting on the beliefs of different religions surrounding life support. U.S. bishops in the Catholic Church believe in the removal of one's life support, while as Hinduists and Mormons believe that ending one's life support interferes with the killed soul's progress towards liberation. On the other hand, Judaism does not even agree to the action of using advanced technology to sustain life because it's against God's will. With so many religions, how could we ever choose? And how could we ever make a decision? Back to you, Raylene.
The family would no doubt feel guilty about whatever decision they make. If they pull the plug, they could be haunted by the possibility of the patient's recovery, however unlikely it is, and feel like they have killed someone they love. Seeing that person they loved day in and day out connected to all tubes and machines has to be exhausting. The loved one probably doesn't even look like their old self anymore. Perhaps pulling the plug would offer closure to all parties involved. But what about that ray of hope? There have been many stories of patients waking up contrary to their doctor's diagnosis. How could one give up knowing that others in similar situations have had happy endings? On top of all of the distress, families have a large financial burden. It is expensive to keep the machines running and to provide care to a vegetative patient. According to the New England Journal of Medicine, it costs around $350 to $500 per day. Not everyone could afford that financial hardship.
Doctors and families are clearly important and able to make a decision about ending life support. But what if they can't agree? Let's go back and check out the end of Stephen Thorpe's story.
Doctors at University Hospital in Coventry agreed to let a neurologist re-examine him, and astonishingly, he detected faint brain waves indicating Stephen had a slim chance of making a recovery.
So what can we do now? Be prepared, talk to your family, have the discussion. Yes, it may be uncomfortable. No one likes to talk about death, but the conversation is necessary. Talk to your family about what you want to happen. Talk about what your family would want if anything happened to them. It is your life. It is your decision. Make it now to eliminate the issue in the future.
Wow, I will definitely go home and talk to my family. Thanks, Raylene and Quinn and all of the staff behind the scenes. That's all for now. Have a good night.